Hello everyone, my name is Chris Cagini and I am the Communications Specialist here at the Stark County Health Department. I'm so privileged to be joined today by our Medical Director, Dr. Maureen Ahmann. She has been our Medical Director since 2009, and so we are so happy that you are here with us today. I have a bunch of questions to ask you about this vaccine, and I'm sure they are questions that are on all of your minds here in Stark County. So Dr. Ahmann, thank you so much for joining us today.
You're welcome. Thanks for having me, Chris.
Absolutely. So first and foremost, is the COVID-19 vaccine safe for me to get?
Yes, like all vaccines, these COVID-19 messenger RNA vaccines were tested rigorously for safety before they were given the emergency authorization for use in the United States. The messenger RNA vaccines actually have been being injected into humans for many years because it's currently what they use for vaccines that are under development, such as for like Zika and CMV, which is cytomegalovirus. So it's true that this is the first one that's going to be licensed in the United States, but they've been studied for many years. So it's actually not a new thing that we're doing.
So it is safe, but you did bring up something that maybe other folks don't know about, and that's mRNA. So could you explain what that mRNA means?
So mRNA, the little m stands for messenger, and RNA is something that is in our cells that helps code for proteins. And so what happens is the messenger RNA is injected into the human, and then it goes into the cells via this transport molecule, which is really cool. It's a lipid nanoparticle, which basically means that it's a little ball of fat, and that little ball of fat protects the messenger RNA so it doesn't break down before it gets into the cell and is able to do its thing. So messenger RNAs are very, very unstable. They only last for a few hours in the body, and that's why they need that little fat protection shield to be able to get in there. What happens is it goes into the cell and it encodes for the spike proteins. Those are the little red things that you see on the coronavirus pictures all the time, these little spike proteins that are coming out from the cell. It encodes for those. Then the messenger RNA actually degrades, goes away within hours, okay? It goes away and it can no longer encode for anything. Then the next time, or if you get exposed to the coronavirus, your cell's memory will remember how to code for that protein so that it can protect you against
To block it.
Yes,
right?
to block it, protect you against it. Now, there has been some talk about, if it's coding for things in my cells, is it going to change my genetic makeup, etc.? That actually is impossible because it never enters the cell's nucleus. So in order to change your genetic code or how your cells are genetically made, that messenger RNA would actually have to get into the nucleus. That doesn't happen. So that's not possible.
So my DNA, my genetic makeup will never be changed by this vaccine.
Correct.
Okay.
Yes.
So now when I do get injected with the vaccine, there are some side effects that I know that I might receive, but can the vaccine, before we talk about those side effects, can the vaccine give me COVID-19?
No, there's absolutely no way that the COVID-19 vaccine can give you COVID-19, and here's why. There's no infectious material whatsoever in the vaccine, so that's impossible. Now, let's talk about that word side effects, okay? So in the scientific world, when we are talking about vaccines, we don't really like to use the word side effects. We like to use the word reactogenicity. And the meaning of that word, I know it's a big word.
That's a big word.
Yeah, it is a big word. But the meaning of that word is, what do we see in a normal immune response after someone has received a vaccine?
Any vaccine.
Any vaccine. So we've been using this word since we've had vaccines. So what do we expect? What type of reactogenicity do we expect from our own body's immune system once we get a vaccine? Again, any vaccine. We completely expect for you to have redness and soreness at the site of your shot. That's something that we see. You can also get a fever because that's your body's immune response, correct? You can get achy. A lot of times when you get a fever, you are achy. They kind of go hand in hand. You can get a headache. Sometimes, you'll be getting the vaccine in your arm, and so sometimes, your local lymph nodes, under your arm could be a little sore. So these are all things that we completely expect, and this is, again, it's called reactogenicity. A lot of people will call it side effects, but it just gets a little confusing because some of those normal things that we expect after any vaccine can also be symptoms of coronavirus. So in that way, if you are unsure what's happening with your body, I just recommend that you follow up with your healthcare provider and let them help you tease out, is this something that normally happens after a vaccine, or could I potentially, have coronavirus? Because we have a very high community spread of coronavirus in our community right
So you
now.
could have been exposed before or after you received this vaccine.
Exactly. And another point is that you're not completely immune to the coronavirus until 2 weeks after your second dose. And no vaccine is 100%. This one is the best that we have had in so long for a vaccine. It's very exciting. But again, no vaccine is 100%.
And as far as I understand it, Pfizer, between dose 1 and dose 2 of the vaccine, you wait about 3 weeks. Or for Moderna's vaccine, you wait about a month, so about 4 weeks.
Correct.
So can you talk a little bit about why we need 2 doses of either vaccine to fight the coronavirus?
Correct. So the first dose of the vaccine is to introduce the protein into your body. The second dose of the vaccine is to then boost your immunity. And this 2 dose is not new either. So for example, for the chickenpox vaccine, okay, so you get your first dose around a year of life, your second dose typically around 4 years of life, because you need that boost, right? The measles, mumps, and rubella shot, you get the first dose in most standard situations around a year of life, the second dose around 4 years of life, again, to boost your immunity. So that's why we saw in the studies that people did need that second dose, just like even the flu shot. The first year you ever get the flu shot, if you're less than 8 years of age, you need 1 dose and then a dose a month later to get fully protected against influenza. So again, needing 2 doses, again, nothing new, completely expected.
So as we discussed side effects and symptoms, I think that's a very important line to draw between the two. So if I receive the vaccine, especially for the folks that are going to be in that phased approach from the state, so some people may receive it before the rest of their families do they need to isolate away from others if they receive the vaccine?
So I would say if you just have a sore arm or something, know that you do not need to. However, there is a possibility that either before or after the vaccine that you were exposed to coronavirus, especially in this phase 1A that we have right now, because those are the people that are actively working with coronavirus patients and in communities, very high risk for transmission. And so if they get symptoms that they are not sure if they're just from the vaccine injection itself, or whether it's possible that they could have coronavirus, then I would ask them to reach out to their healthcare provider to help them tease that out, because it can be confusing. But they do not, just because you get the vaccine itself, remember the vaccine has no infectious material, so there's no way it can give you coronavirus. So just because you get the vaccine itself does not mean that you have to stay away or isolate from your family for 14 days.
Perfect.
Just to make that clear.
That's great. Thank you so much for explaining that. So as we move on now, let's talk a little bit about the COVID-19 precautions that we've all been used to now over this almost a year. So washing our hands regularly, 20 seconds or more, hot water, or at least warm water and soap, wearing a facial covering, keeping that 6 feet social distance, which we are doing right now as we speak. And then another component was getting your flu shot as well, your seasonal flu shot, to continue to boost up that immunity. So I want to ask, if I receive the COVID-19 vaccine, please, oh please, do we still have to wear our masks?
Yeah, Chris, you're not gonna like what I have to say, but no, you can't stop all of the precautions. You have to continue, even with the vaccine. Now, first of all, let's clarify that, because it's not a one and done, right? We're talking about
Right,
2
2
doses.
doses.
And you're not fully immunized until 2 weeks after your second dose.
Right.
So, even for the people who are getting it in the next, week or two, in phase 1A, those people, it's still gonna be a couple of months, right, before they're considered fully immunized. And No vaccine is 100%, we know that, right? This one is very good, better than most that we've had in our history. So, but again, it's not 100%. So we just have to stay the course, Chris. We really have to, until we get to the tipping point where the majority of the people in our community have received the vaccine. And at that time, we can start having a conversation about what precautions can we start rolling back.
Yeah.
Exactly, and it's probably not gonna be like, all right, it's done, everybody do their
Masks
thing.
off.
Right. It's going to be, a little bit more of a scaled approach, just like we scaled it up, we'll be scaling it back, okay? But I would ask that, yes, everybody hold the course, get the vaccine, and, keep staying safe.
Yeah, and we actually have a campaign that we have some local partners that have joined in with us, and we say wash up, mask up, back up, and boost up. And so right now, we want to make sure we continue to do all of those things even after people start to receive the vaccine, just to make sure that we're all safe. So perfect. As we talk about everyone receiving this vaccine and that phased approach and the importance of it to fight COVID-19, recently we've seen some headlines about minority communities and specifically African American and Black communities that are skeptical, given the history in the United States, about receiving this vaccine or potentially any other vaccine for that matter. So what would you say as a physician to those communities to help maybe ease their minds a little bit about this?
Chris, that's a very hard question to answer. I'm not gonna pretend that me sitting here as a white doctor can convince minority populations to trust us to get this vaccine. I would ask the Black community to reach out to health collaboratives such as the Black Coalition Against COVID, which is made up of Black scientists and physicians who endorse the vaccine and really understand the science behind it, and also understand the history. This question saddens me. The fact that the way that minorities have been treated in the United States historically could potentially make them fear a big step forward in this pandemic, and they may not get protected with the vaccine against coronavirus because of the way that they've been treated in the past. Gets me a little choked up.
Well, it's understandable. I mean, it's so unfortunate, that the history that has played out for our minority communities, and neither of us sitting here talking about that is going to make any difference. But the thing that we can do is to put all the information out there so everyone in any community has the opportunity to view it and has the opportunity to hopefully save their own life and the lives of their families. And we, again, as Dr. Ahmann mentioned, as you mentioned, please go to the Black Coalition Against COVID, because they have some wonderful resources, a wonderful video that's called A Love Letter to Black America, that I think is very inspiring, and I think would put a lot of minds at ease as we have these conversations. So I think it's important to talk about as we ask all of our fellow citizens to go and get this vaccine. So thank you for touching on that.
Chris, I do want to mention that as far as the vaccine trial participants,
Yes.
The makeup of the participants in the trial did match the makeup of America. And I know at least one of the vaccine trials did actually slow down the enrollment of white men to make sure that enough Black men were able to enroll in the trial. And so that they had data that was representative of America and not just white Americans. So the effort has been there, but I get it. I get it.
That's right. So we are now moving on to talk a little bit about pregnancy and breastfeeding. Can pregnant women and women that are breastfeeding currently, can they actually receive the COVID-19 vaccine?
Yes, Chris, they can. There is no theoretical risk for a pregnant or lactating woman to get the messenger RNA COVID-19 vaccine. However, there is a very real risk for pregnant and lactating women to get coronavirus, especially in a community such as ours, where we have high community spread. That being said, the woman has to have a conversation with her healthcare provider and decide what's best for her. And what goes into that decision is, one, level of community spread, and two, what are her risks in her job and in her family, et cetera. But again, it has been recommended that pregnant and lactating women be offered the vaccine, and there's no theoretical risk. Now, with vaccines and pregnant women in the past, when a pregnant woman can't get a vaccine, that usually refers to live vaccines. Okay, so pregnant women are not allowed to get live vaccines, but there's no virus in this vaccine at all. There's no infectious material.
So let's stay on children for a second, because we're talking about preborns and newborns. So for those who have toddlers, adolescents, should children be receiving the COVID-19 vaccine?
Yes, they should. The issue right now is that we don't have enough vaccine. So we are rolling the vaccine out in a phased approach. In the highest risk people are going to get the vaccine first. And children tend to be lower risk, have lower risk. But in order to eventually have the entire population protected, children will eventually need to be getting the COVID-19 vaccine, but they're lower down as far as with the phases. Additionally, currently right now, one of the vaccines is given the emergency use authorization for ages 18 and up, and the other one is for ages 16 and up. And so right now, it's not currently authorized for children less than that, but as more data comes in, it will be, and then we will be offering that to children as well, my own children.
Well, thank you for your answer on that. I think it's so important to put parents' minds at ease right now to see if children should or will even be getting this vaccine. So I appreciate you answering that. So let's move on to another buzzword that we've heard a lot throughout this entire pandemic, and that's the word immunity. So is natural immunity from COVID-19 better than receiving immunity from the COVID-19 vaccine?
So getting infected with COVID-19 does not guarantee that you're not going to get infected again. And we have actually seen recurrent infections after 90 days from your original infection. In addition to that, when people who have had the natural illness of COVID-19 were tested for antibodies after their infection resolved, a large percentage of them, 25 to 30% of them, didn't actually have evidence of antibodies, and you need the antibodies to give you protection long term. On the flip side of that, the COVID-19 trial participants, the vaccine trial participants who had antibodies tested after the vaccine, 100% of them did produce antibodies. So at this time, the clearest way to have long-term immunity against COVID-19 is to get the vaccine. And Chris, the concept of herd immunity actually came from vaccine research. So we can't really use that same concept in natural infection. It was never meant to be used for natural infection. In fact, studies show that if we were to try to obtain herd immunity, even if studies shows what they don't, that after a natural infection you have long-lasting immunity. But again, remember, studies don't even show that. But even if they did, in order to obtain natural immunity or herd immunity from natural infection, another 40 million people around the globe would have to die. Studies have shown that you don't have long-lasting immunity after natural infection, so it's impossible to obtain herd immunity in a community based on natural infection alone. We really need to have the vaccine.
So as we speak about immunity, we really are in the start of the flu season, of course, which is still a thing that's been a big misconception. But I want to ask first, if I already received my flu shot or plan to receive my flu shot, can I still get the COVID-19 vaccine when it's time for me to receive it?
Yes, getting your seasonal flu vaccine does not make it so that you cannot get your COVID-19 vaccine. However, it is recommended that you don't get any vaccine within 14 days of receiving your COVID-19 vaccine. So I would say if you just got your flu vaccine, just wait 2 weeks and get your COVID-19 vaccine. If you are in a community such as ours and you are in phase 1A, meaning that you are at a higher risk, you're taking care of higher risk populations, and you have been told that you're able to get the COVID-19 vaccine in the next week or so, then if it were me, I would say, okay, well, the incidence of influenza in our community is not very high right now, but the incidence of coronavirus is high. So I personally would take the coronavirus vaccine, and then you have to wait, depending on which vaccine you have, 3 or 4 weeks, get your second dose. Then 2 weeks after that second dose, then go ahead and get your influenza vaccine. So in addition to that, Chris, as far as, I do recommend everybody get their flu shots this year. We are definitely tracking it. Those numbers are even being reported. I wouldn't be able to tell you that we have a higher incidence of coronavirus right now if I didn't know that the incidence of influenza. Also, in addition to that, many centers are actually testing, at least in children, at the same time they're testing for coronavirus, flu A, flu B, and RSV. And we're doing that because one, they're treated somewhat differently, and we can predict the time frame of when kids worsen and things like that if we have that information. But two, we're not gonna know if the scales tip and we have more flu or RSV than coronavirus unless we're testing. So we are testing that, in children at many centers across the state. So rest assured, we are keeping tabs on that. I honestly think we're just not seeing as much as what we normally would this time of year because a lot of kids are doing distance learning and people are wearing masks and quite frankly have better hygiene and a lot of people are heeding the recommendations and are staying home if they don't feel well, so then they're not spreading it to other people.
Yeah,
but we're definitely watching for it,
which is understandable. And here at the Stark County Health Department, you can also come here and get your flu shot.
Yes.
So we have that information on our website as well.
Yes, there are ongoing flu clinics happening.
Absolutely. So my final question for you is, I have appreciated this conversation so much. I do want to talk a little about this phased approach that has been rolled out from Governor Mike DeWine's office and the Ohio Department of Health. There are currently 4 phases. We are just in phase 1A and not even halfway through phase 1A yet. So I wanted to ask you, if I'm a member of the general public, when will I actually get my vaccine?
That is an excellent question, and I can't answer that right now. We have to stick with the phased approach, and we don't want to get into a situation where, I say, I think in the fall we'll have enough vaccine for everybody, because I honestly don't know. So I think of it as like an iceberg, and the phase 1A is at the very tip top. These are the individuals such as people working in the COVID units in the hospital, the first responders, residents and staff in the long-term care facilities. They're at that top, and we have to take care of them. They're at the highest risk. They're the top of the iceberg. They're at the highest risk. And then we have to go down the next phase, the next phase, and the next phase. But we know how that's all going to roll out, but we can't say who's gonna get it when until we actually have the vaccine in hand.
Okay.
So once we get the vaccine in hand, then we can say this is who is gonna get it at this time. And we are going on the guidance from, Governor DeWine and the Ohio Department of Health. So we get the vaccine. It's a very intricate process. Here, even at the health department, Chris, that we know that we're gonna be getting a vaccine between this date and this date, but not exactly what date. And so we have to have contingency plans based on all these many different variables. If you get this date, then we're gonna do this date, et cetera. So it's very complicated, but as far as when the general public is gonna get it, I can't tell you at this time.
But when it comes to that time, we have, I think, really laid the groundwork that it's so important that you do get it, and that you follow up with a healthcare provider to make sure it's the right thing for you to do. So, Dr. Ahmann, I so appreciate you being here and having that conversation with us today. Is there anything else you'd like to tell our community?
I would say stay the course. I know it's been rough. I know it's been a long year, but stay the course. And please get your vaccine when your time is there, and then only then can we start talking about rolling back all these safety precautions and getting back to what we know from previous is normal, instead of this new normal that we have.
Well, thank you. Dr. Maureen Ahmann, our medical director, thank you so much for joining us today. And for everyone else out there, for COVID-19 updates on this vaccine, please visit starkhealth.org. You can follow us on Facebook, Instagram, or Twitter as well. Thank you so much, Stark County, and please stay healthy.